Collins, how are you, Brian?
Hey, Bradley. Live in 6 hours time.
Yeah, right. Exactly. Well, you'll be happy to know finally I actually had to get up early to have a conversation with you instead of making you stay up late. So listen, everyone, I am super happy everybody's joined us on our masterclass. My name's Brad Moore. I am the CEO of GCAC, and I am joined by Brian Collins, who is the CEO of Abbey Technologies. And Brian is the real deal Irishman, as I like to say. He's my partner in crime around this. So we're happy everybody who's been had a chance to join us today for this masterclass. For those of you who had an opportunity to come on and take a look at the Doctors Roundtable, which we participated in this morning, thanks so much. It was a great conversation. It's really interesting as a Canadian in a very well-established marketplace to actually see what's happening and see the similar types of questions that were coming up across the broad spectrum. And then, unfortunately, to a certain extent, the questions have been coming up over and over. So to that point, we're going to break this down into 3 pieces. We're going to start off. I'm going to go through some slides. I think everything here that you're going to see is not going to be mind-boggling to anyone. It's not going to be earth-shattering things you didn't know. But we put these things together specifically for the purpose that we think these are what can be addressed. Cannabis has a great opportunity. And I'm going to talk a little bit about my own personal experience about where there was an opportunity, and because of where it's at in the industry, even I, as somebody who's in the industry, didn't feel safe like actually using it. And then at that next part, Brian will actually go in. We want to show you the Efixii program in a live demo. And I think this is really important. If you're a cultivator, if you're a manufacturer, if you're involved in the supply chain, if you're a medical professional, if you're a regulator, or if you're a patient, I think you're going to find this extremely interesting. And then the last 10 minutes, what we're going to do is we're going to just open this up really quickly for some Q&A to go through to answer any questions that we can. So with that, I will share my screen, and hopefully I get this right. This is why we have Brian, the technologist, right, Brian?
And Aaron helping us, of course.
And Aaron helping us, that's right. Okay. So here we go from the start. So I assume everybody can see this?
Yes.
Is it a full screen? Okay, good stuff. So better patients. So welcome to Citizen Green Technologies, better patient outcomes 1 gram at a time. And I think that's a super important statement for the industry as a whole. So one of the things we had the opportunity to talk this morning about with Dr. Moore and the my old age is showing up in here with Darren or Daryl was the construct that we're dealing with the plant. And I think this is really, really important to look at. When in 2018, I spent 8 months in Israel, and that kind of ongoing argument is that we're dealing with the plant. So every plant, like every person, is unique. And we have to recognize that. So instead of trying to come at this in a very kind of traditional methodology, we have to understand there's a lot we know, and then there's a lot we don't know. Having said that, there's a lot of great opportunity just in the fact that we recognize that problem. So to that extent, traditional clinical studies don't work great on plants. Now, that's not a net statement of that's the way it is. It's more of a generalized statement, and there's always things that are subject tos, right? So for example, one of the ensuring that drugs are safe and effective, the conditions under which the drug is manufactured, not the conditions under which the drug is growing or the plant is growing. So when we look at that, I'm a huge believer in clinical studies. I think they empirically add to the data set, and I think that's critical path. It's so important. But we also have to understand that what we start with from a clinical study might not be the same product in essence all the way through when we're manufacturing and put it out. And I think that's really, really important and something to show. So I understand my screen might not be showing correctly. What are you guys taking a look at right now, Brian?
Brad, you're on play. You could come out of the play and just go into full screen mode and not presentation. Exit out of that.
Is that better?
Yep, that's the one. You're on slide 3.
Good stuff.
Thanks, Brad.
Perfect. Thank you, Brian. Thanks, Brian. So the next part, so this gets to an interesting thing. So what we've got here is we've got varying start points. And so if you look at how things are traditionally approved through a start to finish in an approval process, and as such, you come up with clinical studies, and from those clinical studies, you can then have the ability to write meaningful regulations. There's a whole process. How do you get to the point where you can regulate when there's nothing to regulate? And I think that when all you have to do is, like, for example, from this graphic is just take a look at around the world. I think United States is a very good example. We have the product being used for recreational purposes in some states. We also have it being restricted in some states. We have medical programs. And then we look at that's a very good example just in the 51 states of the United States of what's happening in the rest of the world. As you know, in Canada, we have 2 programs. We have a recreational program, which allows you to go buy it and grow and have a certain amount of your own possession. Then we also have a medical program where you can get it, but you can also grow it. So it's these hodgepodge of regulations. And so you say, well, why? Why is that such a big issue? And the issue is, from our perspective, and once again, what we're trying to achieve, it's just a lack of regulation. It's a lack of data. You know, EU said something 18 Q4, or maybe it was Q1 2019. They said something. We need to take it off Schedule 1, and then they said, but we need more information. And so information from our perspective comes from data. Data comes from technology. So the net end result of this, I think, I think everybody who's in the industry would probably agree, to a certain extent, especially if you're on the other side of cultivation, to a certain extent, because of the lack of regulations, cultivators have been empowered to be self-regulating. And to a certain extent, what I mean by that is not write the actual regulations. As if, for example, you look in Canada, you don't see the same for example, growing standards as you would see in a place like Israel, or even so much in different states. So we've got this hodgepodge, and especially when you end up in different places like, let's say, Colombia, where or South Africa, versus, once again, versus the EU. I think what we're starting to see is the pain on the industry of this lack of process. And so what the growers have done is they've taken upon themselves to kind of focus on the growing angle. Problem is, now you have the tail wagging the dog. For example, I'm not going to talk so much about what's happening also just in Canada, but it's not just happening in Canada with labeling. It's also happening, with regards to in Massachusetts. It's also happening in California. It's also broad spectrum. And I think our speakers on the previous stream, when they were talking, or presentation, when they were talking about blockchain technologies, when there's a lack of data, technologies can do things. When there's a lack of data, it actually gives you the ability to kind of almost, for us, reverse engineer. I'm a huge believer in seed to sale. When Brian and I met, he was very strong on seed to sale. I'm also a big believer on at the end of it, on the patient. So how did we get those two together? And, as I can tell you, as a cancer patient who went through treatment recently, who luckily came out the other side, who was issued opioids to deal with pain, it would have been just too much to try to figure it out on my own. I couldn't really even go talk to patients at the cancer or doctors at the cancer clinic about what I should take. And so I think this is where technology can do something where we just haven't been able to do it yet. And I think that was very appropriately laid out on the last stream or the last presentation. And we hope to show you a little bit more of that today. Medical professionals, you know, when you talk to medical professionals, you know, they go to medical school to learn how to trust information based on a certain methodology and a process. And you know, there was a very interesting article I wrote in the Globe and Mail about what one Canadian doctor is out there talking to other Canadian doctors. And he goes, establishment as a whole is very loath. They're very resistant to anecdotal information when there's a lack of other information. So you get caught in this Netherlands. And I believe doctors are kind of pulled at it when people are approaching them. So is it, no, I just don't believe in it, or I don't know enough to believe to what to believe in. And so I think that once again, the focus has to be on better information, and we can talk about it or we can come up with solutions to do it. And I think that's one of the things, hopefully you'll see in a minute what we've been focused on. So in my world, efficacy is key. We look at everything as a closed loop system, like an infinity loop. So for, you know, in this case, it's a square infinity loop. But when you take a look at it and and once again, the ability to track starting with seed to sale and moving all the way through as the data points are collected. And then most importantly, what we call sale to seed, that all important consumer data set, you get yourself into a position that you start to layer things in. You've got what happened on a per gram basis. When you get things on a per gram basis, even what you don't know about the plant, you can start to isolate information and put it into groups, right? And start to understand where in here on this person's experience is so radically changed for somebody else. That can be on a batch to batch basis. That can be on like an ailment to ailment basis. It can be on a lot of different bases. And I think one of the things that you're going to see and what we're going to show is when you layer these things in, you get yourself into a very unique situation to come up with something that we call average efficacy. And that's just a big data play. So to that extent, what we'd like to do now is I'm going to turn everything over to partner Brian. He's going to take you through a demo of the solution, and then we'll take questions from there.
Thanks, Brad. So this being a masterclass, what I want to be able to run through is actually the implementation of what Brad has been talking about. What we talk about here is the facility or ability to register events in the life cycle of a cannabis plant. And the life cycle for these purposes really are from seed. I know it's fairly well traveled road to seed to sale. So it's all the way from mother plant seed through to batches and so on and lots to distribution. But most importantly, it's as far as consumption. And then post-consumption, you have efficacy feedback. So our system is effectively built in a blockchain-driven efficacy solution. So it's important to know that people who consume your cannabis product, ingest your cannabis product, who then report on its effects, whether it's a skin cream for eczema with CBD in it, or whether it's THC for pain, various other things, then we allow them and we encourage them, in fact, by giving them rewards, to actually feedback. And I do this a little bit in reverse, because when you download the app from the App Store, you can download this app right now yourselves and you can see what I see. So for this, you can go into a treatment session, for instance, and I can give efficacy feedback on the product. And I'll scan a QR code. And let's, for argument's sake, say my QR code here is called Shoppers, and I scan it and it says Shoppers, and I'm trying to treat maybe lack of appetite. And those of you who know me will probably have a laugh at that one. So there's my lack of appetite, and did it help? So it really helped. So very good. So this is me actually giving efficacy feedback on a cannabis product that I have just ingested. And now what I do is the notarize button on the top right hand side. What that's going to do is I'll turn my camera away from my face at the moment. I hit notarize. It's going to look for my Face ID. When it finds my Face ID, it'll unlock a private key on my phone, and it will sign the transaction, blockchain transaction, on my handset. That information is now sent to a blockchain, which is the truth of this information is now certified effectively by me, by my Face ID. And for that, I'm giving them a reward. And in this case, the reward is actually some telephone credit. I notarize the fact that I want to collect my reward. This could just as easily be points for flying, or points for your local store, or points for the local pharmacy, and so on. It's just a reward, thanking them for actually giving us the feedback. So that's how the app looks to everybody. And they can do other things, like they can scan a product QR code. They can report a fake. If they see a fake version of my product, and actually report it for me. This has a GPS pin, as you can see in the icon there, and it will actually drop a GPS pin and tell me where the reported fake was. I can claim my rewards, I can buy again, I can do a usage report. This is quite interesting. The information that I've just given in is actually driven and given into me by virtue of a report. So I can see the trend of my consumption in statistical analysis that we have. That's what our machine learning system does. And I can offer suggestions for this person because of their way, it may be not working for them because their dosage is a bit low, or maybe it's too high, and so on. And we have all this other information from other people. We don't show other people's information to you, but we do show you your own information. We can see your activity and your efficacy rating and how all these things are actually building in. So we have a big data repository that we're collecting here, but most importantly, we're actually working with the client and the customer and the patient here on the phone. And it's really simple to use. You can see it's 2 big squares. It's not really difficult. And then after that, if you want to do other things, for instance, when Brad has a dropship license done, he can request, or you can, here I can request a cannabis consultation. And I can go in and give him my phone number, my zip code. It'll send a push notification to my local healthcare clinicians and clinics and so on, and they will call me back and then coach me over the phone about whether this medical cannabis is right for me, what my dosage is, fill out the cannabis health form and send it to the local, using secure fax of all things, send it to the local healthcare clinic. Now you can request various other parts of COVID and so on. So that is really just a top level view. But what's most important here is something that is really quite dramatic, I suppose, to a large extent. Let me just do something here. I can tap a KYC button here. So before this, I was an anonymous consumer. Now I'm not playing the role of an anonymous consumer. I'm playing the role of somebody who's actually participating in the value chain. So I am now going to play a role of a cultivator, Purity IQ, which is basically your intellectual property protection using blockchain and cannabis genomes. You have a distributor, you have the healthcare practitioner, which I just mentioned for cannabis consultations, and indeed you have a retailer, anybody who's going to retail. So if I undergo Efixii cultivator KYC, then that information goes back to Brad's back office. His team then review the KYC, make sure, and we run it against bad actor lists, sanctions lists, FBI most wanted, no-fly lists, and so on. So if this person is a bad actor, we do not want them telling us about cannabis. We don't trust them. So we know everybody who's going to tell us about a cannabis event in any product's life cycle that I've just ingested, that cannabis event will be from a known person. That's really, really important. So with that in mind, I'm just going to switch mode here in my debug version. What I'll actually do here is I'm just going to turn on the role of cultivator. And lo and behold, most of you folks won't be able to see this, but if I refresh my screen, I now have new tiles because I am now actually being approved by Brad's back office as a cultivator. What's the first thing I do? I define my grow. What's the name of my farm? What's the name of this, etc. And all I do all through this, I add logos and selfies and locations. I then define my mother plant. I can add a mother plant. I can take my fingerprint kit. I can receive a certificate of authenticity. I can do a photograph of the mother plant, the date it was planted, obviously its genome and seed, and record other events that may have happened, whether I have to use a pesticide this week, or whether before a clipping I had to do something else, like with feeding regimes. I can record all of these things. Why is this important? Well, it's because all of these events that the grower, the cultivator is going to attest to, they will be shown to you, the consumer. You're going to walk into a store, a pharmacy, an Aldi, a Lidl, wherever it's on for sale. You'll hold up your phone, you'll scan a QR code from Brad, and it's going to retell the story that I show you here on my screen. So next, I'll define my greenhouses, my grow zones. I'll define a batch. I can create a batch. And of course, I create a batch from a mother plant. So I have to nominate the mother plant and the grower and all these other parts. I link all of this effectively supply chain events together. And now the batch is grown. And when the batch is grown, what is it doing? Of course, it's harvested. You photograph the harvest. You may use a drying oven if you're using CBD that's going to go into an oil, for instance, and you're not going to ingest it by smoking or something. So you can do all of these things in the batch. When the batch is grown and harvested and dried, you can then send it to a lab. You have all your laboratories. All of our systems were designated a lab, a batch, a farm, wherever I'm attesting to events. All of them are GPS location driven. And we can ring fence using geofences. So if somebody says, oh, here's a photograph of a cannabis plant and it's 12 miles away from where it's supposed to be, then we will not allow that to occur. So you have to be on premises and you have to be the right person that we've KYC'd in AML. There is no more trustworthy solution on planet Earth about what you're about to ingest in your system than this platform. It tells you every single step of the way. Then your lab result goes in, the Purity IQ fingerprint. This attests to the intellectual property of the fact that this was grown, this batch was derived from this mother plant with this fingerprint. All those things happen under the hood. After that, then what you're going to do is you're going to distribute the product. You're going to send it to a destination. This is very important. You create what's called a digital twin QR code. And that QR code is created at this juncture while it's in transit. We use this in Europe in particular. I'm based out of Switzerland. We use it so that when you cross the border and you scan the QR code, it will show the goods are in transit. And then when the goods arrive at the destination, the receiver of those goods at the depot or the pharmacy, depending on where you shipped it to, will scan that QR code to say it has arrived. It's no longer in transit and therefore can be cloned and scanned through the border and pretending to the border guard that this is the same shipment. So this is all part of the compliance side of things that we do. So not only do we do compliance of who's doing the attestation for all of the steps of a cannabis life cycle, we're actually also going through who's actually the process of the goods being transmitted. And one thing there, any of you who have a camera phone on you at the moment, it might be worthwhile, if you want to try this, to be able to see how a story is told. If you hold your camera up and you scan that particular QR code, that QR code is going to tell you a story. That story is going to tell you all about what has just occurred with this plant, when it was grown, when everything else, all the events to do with it and how it's been worked. So it's just to show you how the whole system actually hangs together. And as I said, this app is available right now on the App Store. So when you now go through and you do all that, I'm going to come back out from being a cultivator. I've now gone to my Aldi and Lidl and back to what I said before. I see a QR code on the screen, or I see a QR code basically available to me to scan. I can just scan it and it's going to tell me all about the goods that I'm about to ingest. And Brad's back office at that point has all the data points effectively for the consumer, all the data points for the cultivator, the retailer, the distributor, everybody involved in the value chain. And there's dozens of people involved in the value chain that basically buy a license from Brad on a software basis. So it's a SaaS model, software as a service model. Then they contribute all of this data into the back office, and then Brad's system with his machine learning and his AI build a big data picture on every grower, every strain, every consumption event, every negative reaction. It's effectively like a clinical trial, but it's for every single cultivator that licenses Brad's technology. And that for me is really, really critical about the whole thing and how it starts. You just come back to how I started with at the beginning, is to say, I have bought this product, it's in my home. For instance, just to give an example, if I turn on my camera, there's a cannabis plant here that I can see. I can see the QR code here. I can tap it and it's just going to go in and tell me all about this product as if I just bought it from the store. So it's just going to tell me everything I need to know. I can then hit the plus minus. It's just going to tell me the full story, the name, the logo, when it was planted, the selfie of the farmer. There you go. That's an interesting photograph. So other photographs. Here's the Purity IQ fingerprint kit. So that's how that looked. That's a bit of a joke for us. And then we go down to the genome and the seed. For instance, we can talk all about where it came from, us THC, CBDs, all the various parts of the plant done. And then we just can go down and tell also when it was added, how it was harvested, when it was dried. This is information that me, before I'm going to rub a cream on the elbow of a child with eczema that says CBD cream is good for eczema, I want to know that I'm about to rub that on the elbow of a child to make sure that it is legit, grown properly, has been attested to, has a lab test that I can actually look at. Now, if there's any photo events that I need to see, what lab results look like, so I can go and tap the lab results it passed. There's all the various terpenes and all the analyses that you can have. And if you're a parent or if you're somebody who needs to find decent cannabis-based medical products or cannabis-based CBD foods, then this will tell you more about your product than you're ever likely to see from any other platform in the world. And then that big data goes back to contribute to the efficacy of the plants themselves that are planted and then consumed. So with that, I'll toggle it back to you, Brad.
Okay, that's great. Thank you. Brian, I think we've got some questions here that we should jump into. I think one of the things that's really interesting is when you look at, for example, you showed that lab report, these things that are happening with investigations around, mislabeling. There'd be non-starter conversations that would just never be there if people were using the system, correct?
That's true, Brad. And the other point is that if it's a mislabeling, the important thing here is that with any law enforcement and any breach like this for foods or otherwise, at least you can find the person who did it. So you can say, who said that this has 72% or 12% or whatever? Who said that? And we know we've KYC'd you. We have your photo ID. We have a selfie. We know where you live. These are important steps. So we say this cultivator has this bad actor in their horticulture lab management system, and he or she lied about the content. And at least then we can go and say, right, there was a lie told. It was this person, and let's take it from there. And we apologize to our customer base, but we have rooted out the problem, and we have now, moved on and improved our processes, et cetera, et cetera. So there's attribution for any negative effects that may occur way down the line. But the beauty of it is, Brad, those negative effects, if it is again a cream or stress, anxiety, ADHD, whatever it might be you're trying to treat, at least that information is being fed back into the system, and we can find those bad batches, not just go, oh, that was a bad one, So that's really not sufficient as a platform that says we're going to tell you the truth, always the truth. That's important.
Yeah, I think one from the last presentation, that's such an important thing, right? Because with the lack of regulations, the truth can vary, and it's a respective thing. And so when you look at my graphic about the regulations all over the world, that's not a function of bad actors. That's just a function of lack of information, right? And that's really what we're trying to go. Our objective working with Brian is that we want to capture 128 million grams over a 2-year period. If you take a look at that, 300, that's like 400,000 people in an ongoing clinical study. And one of the things Brian showed right at the beginning with those reports, that's data moving backwards. That's data moving back towards regulators, to the cultivator, to everybody involved. The system is so easy to put into, and I want to answer Tom's question because it goes to one of the points about what's the net end result of this, right? And it's about better outcomes for medical cannabis patients. But we can shorten that. It's about better outcomes 1 gram at a time, right, Brian? And I think that's really what we focus on building, because once again, if every plant is unique, we start to not have to look at averages. So Tom asked, do you think that machine learning will help us to find out further scientific benefits of cannabis for patients, as well as the potential to find new uses and compounds which may be beneficial for patients or other purposes? Tom, that's what this is all about. That's 100% this is about. There's a lot of great technologies out there that can tell you how to get it from A to Z distribution and on the block, using the blockchain for security. What we really care about is the product, advancing, and that is what was talked about before. And it's been explained to us. People need to trust it. It's not just about, you need to trust that the next time you use the product, it will be as similar to the same first time you use the product, right, Brian? And I think with the level of the data sets capturing it, it actually allows, if you have an outlier, Tom, when we run these reports and run it through algorithms, you start laying things over, you start to see, oh, there was a variance here in temperature, or a pH level was off, or the genetics had an interesting kind of like off to the right. And that's one of the things where our partner Purity IQ is very big in. It's about those genetic fingerprint. Here's the mother plant and here's start point, at least so you can see variations all the way through.
One thing, Brad, just to address that from Tom, just what are the other benefits from it, Tom? It's important that when we have the likes of Purity IQ on board and other testing solutions, that they give us disclose to the customer, because there's a lot of IP in there. Sometimes we give you the higher level terpene and so on. But they do give us a lot of underlying information. And to your point, are there other benefits that will come along? Well, you know what? We get feedback. Our app is the only system in the world that gives you feedback. So we can now say, look, this has been particularly good for stress management, this particular strain, these particular attributes of this batch. And we can then feed that back to the cultivator and they grow better product. That's what it's really all about. So
exactly, feedback on a per gram basis, right? And I know we're all talking about batches, but there's subtle nuances there. And if you're anybody in the supply chain, I suggest you have a chat with about this, because that thing about that digital twin, a lot of people say, how much burden does this put? A lot less than you think. And right now in Israel, we actually have I'm going to jump into Katie's thing, because this actually what I'm going to say answers Katie's question. But what's interesting in Israel, the Israeli cultivator got the regulator to approve this system to actually submit their compliance on. That's huge. If you guys know anything about the Israeli system over there, it's tight, right? And in Europe, dealing with the largest CBD producer, the guy said, "Hey, listen, this is a new idea. This is a new construct. I'm going after a marketplace or somebody who might never use CBD. I just want people to have trust." And so, you know, that whole construct and argument all the way down is that you have, you can reduce compliance costs, you can increase sales. The trust will increase sales, you reduce compliance costs. But how do you really increasing the trust? By creating enough information to get better and better at what you do. It's not just about what's on the QR code, it's about a repeatable, predictable product. And that's where the gap has been. I've got a question here. Hopefully that answered Katie's question about the big data. It's all about big data, Katie. It's about layers of big data on a per person basis. We have to look at that until we know what all the cannabinoids are and we can deconstruct to reconstruct the product. That's where we got to go. And, like I said, as a guy who walked in, who had to be on 17 different prescriptions afterwards to deal with radiation burns, I would have loved to have anything. But you know what? I can't take that chance to put something in my body when I don't know what it is, when I'm already suffering. And there's, especially in medical, and that's why we focus on medical. I would love to put this into recreational, but you know what, at least in medical, I know the direction is there towards about the end consumer, about the patients, and about regulation, and about getting it approved. All the key ingredients, this solution actually does this. Providing patients with the lab analysis will enable them to track subjective effects to both major and minor cannabinoids. Exactly. This data will provide, will be invaluable, especially when we increase focus on minor cannabinoids currently and the lack of data. You know what, Matt? 100%. 100%. Look, like I said, if I get 128 million grams under contract, the average person for medical purposes is using 300, just rough numbers, that's 400,000 people. And that's going to be layers of data. Hopefully that graphic showed you that whole QR code that's supposed to represent data stacked on top of each other. And, our objective is to get to something called average efficacy. We're not saying, what we're saying is, let's put it this way. What we're not saying is we have the answer to how cannabis cures everything. What we are saying is let's at least start on a way to collect the data that somebody in a regulatory process can look at it and say, hey, you know what? This is much better than anything that we've had in the terms of the mass data, the security of the data, and the usability of the data. Regulators can't write something that they don't have anything to write about, right?
That's a fact. And so the other point here is I just wanted to kind of mention, Brad, on the larger growers that we're talking with at this point.
Yeah.
It's important that they're also get really in their value chains. To Matt's point, is that it's very difficult to get subjective feedback into your supply chain. We can all talk about supply chain interruptions and blockchain and stuff, but the reality is that blockchain in this circumstance is actually all about the truth of the data I'm ingesting here and I'm feeding back. And it's that subjective feedback that we really want. Like there's 50 different types of paracetamol you can buy in your nearest pharmacy. Which one is the best? Who knows? But if they all had a QR code, you could take a look, and you could take a look for your demographic. So your age group, perhaps male, female, etc. You can take a look at that, and one might just stand out better than others. So we're the same, really. It can be applied. We're applying it here to cannabis because of its controlled substance benefits and medical benefits. You could just as easily supply or provide this level of information to tomatoes. You could do it for anything, really, in your local discount store or your local retail food shop or whatever it might be. So this information and its feedback is really, really important.
Yeah, 100%. And I think when you take, hopefully everybody who's watching got an opportunity, this is the core-based technology. How we're using this around the world is variant to what's happening in that particular. So interestingly enough, in Canada, we went and we got a non-possession selling license. Well, why would we do that? We're a technology company, because we're laying ourselves in between the consumer and the cultivator, and we're going to educate the heck out of the cultivator or the consumer, and hopefully that will educate the consumer, the cultivator, because am I mixing this up again, Brian? Yeah, Brian's telling me I shouldn't do math or complicated sentences. But I think one of the things that's really important, if we can work and educate the consumer and create that consumer pull through, say, listen, don't ask me to do something that you want to do yourself. That's simple, right? And that argument applies down in any one of the states as they're emerging and growing. And we've shown it in probably one of the most regulated markets. Like, you don't have those types of issues like that we've had in Canada about mislabeling Israel. It's too tightly controlled. And the problem with that is you can't get growth. And what we're trying to show in the EU is there's a better way to do it. And one of the things I really kind of want to emphasize about the construct of blockchain is doing in this industry because of data what crypto did in banking. It removed what it did is it took the bank out, then the regulators get lost. Well, that's when you have data, right? When you have information, they had something to write it around. Now it turned them upside down. What we've done is we've seen blockchain can actually create the data, the right meaningful regulation, the thing to allow the industry to grow, to build trust to consumers. And most importantly, when I, as a patient, go talk to a doctor, that doctor can have confidence. That doctor can have confidence in saying, hey, Brad, here's 3 options. This is what I know about them. Why don't we go down this direction? So that's what our objective is.
Yeah, very good. And look, ultimately, this is about simplicity, Brad. It's about allowing normal retail consumers ingesting these products to feedback so that we already have the seed to sale platform. We already have the retail, the distributor, all the various value-added components to any of these products. And we are just allowing consumers to feedback, and we'll give them a reward when they do. Because what we're really after is the data so that we can learn from that data, make better recommendations to growing, and make better recommendations to regulators, most importantly.
100%, Brian. And I think we've seen some uptick in some of the partners that we're working with now, right? And you've seen that with Bless Industries in Israel. You've seen that with CBD Agricast, the largest producer of hemp out in the EU, out of Romania. You're seeing that with Herb Industries. There's a lot of incredible things and very innovative companies. So when you look at their other partners, it's not just about, hey, let's put something in the ground, let's get it out the cheapest cost per gram and kind of, let it happen, right? These are people that are making the investment and the time, once again. So it's not always about, you can't say it's medical just because you have a green neon Red Cross sign in front of your dispenser. I'm sorry, that just doesn't fly, right, Brian? Show me. Indeed. Show me. And I think that's what we've done with Efixii. It's Citizen Green Global Cannabis. Reach out, send me an email at bmore@cannabcorp.com. We'd be delighted to talk to you a little bit about it. Look at what you're doing, what you're trying to crack and achieve, and have some good, healthy conversations about better outcomes for medical cannabis patients. So I think at that point, I am getting the nod that we are just about done, or we're done. So thank you, everybody, very, very much. Brian, once again, as always, it's a pleasure.
Thanks, Bradley.
Thanks for joining us. And to all our friends at Prohibition, thanks for putting this together. And to my fabulous team for getting me organized, how to plug in my headset. I appreciate that time too. Thanks, everybody.
Cannabis for your arthritis?
Yes.
Does it work?
Doctors say it helps manage pain.
And it's regulated by the government. My daughter downloaded the new Efixii app to guide me. Is it safe?
It is.
Secure too.
I just tap healthcare.
Then request cannabis consultation and enter my phone number and postal code. A healthcare specialist gets a message that I need help. In a few minutes, they call to walk me through the process. Efixii Medical Cannabis Solutions start with talking to a nurse to evaluate your condition. Next, they help you fill out Health Canada forms and select dosage. They send the secure document to Efixii. You can now choose a product from a list of licensed vendors who package and mail your medicine. For your safety and to prevent fraud, each package comes with a unique QR code to scan to confirm delivery and provide product data and ratings.
Now that I've tested the medicine, I scan the code again
and send feedback to help others make better decisions. As a bonus, I get free minutes on the Talk It Call app. I'm going to call my granddaughter in Paris. Thanks, Efixii.
Powered by TraceLocker, Citizen Green Efixii is the world's first blockchain-powered RegTech compliance solution that enables a fast, agile registration of medical cannabis and CBD products. Simple, secure, and intuitive, Efixii was designed with leading medical cannabis and CBD cultivators from Israel, Canada, and Switzerland, and was built to align with their cultivation, distribution, and compliance processes. Let's follow the journey of our favorite medical cannabis grower, Susan, as she uses Efixii to help her successfully grow, test, and ship her products to market. Efixii allows growers like Susan to record each of the critical steps involved in cultivating and distributing. At the heart of Efixii lays a powerful blockchain back office that ensures every piece of information is recorded, secured, and associated with a verified user, a recording process called attestation. Each user profile is created by establishing a blockchain e-wallet on their smartphone through the TraceLocker KYC app that verifies a person's identity during registration. All personal contact information, including photo ID, is validated according to local regulations and in compliance with international AML standards. Only verified users may record events. Using her smartphone's Face ID, Susan enters cannabis event details that are immutably notarized on a blockchain. Efixii has made the process seamless so that every step of Susan's cannabis product journey can be thoroughly verified by regulators, customs officials, and consumers. Excited to get started, Susan uses the Efixii app to set up her company's profile, including logo and grow location. Next, she defines the base mother plant for each product grow, including the genome and seed, as she records all relevant information related to the mother plant's lifecycle. Susan's farm has multiple large greenhouses with separate grow zones. Susan is ready to start growing a cannabis batch. All the steps from taking cuttings, taking pictures, noting the growing zone, watering times, pesticide use, and lighting can all be logged using the app, right up to harvesting. With her batch ready for sale, Susan takes that next step, product testing by a lab. She creates a lab profile that includes the lab name, address, and the weight of the test sample. Then she takes a photograph of the shipping label. When the lab verifies potency and terpene analysis, Susan takes a picture of the lab report, and now this entire cannabis batch is shown to be legally compliant and ready to be packaged and sent to the market. Efixii continues to help Susan in her business's next phase, getting her cannabis product to a distributor or retailer. Using the app's proprietary process management, Susan creates a unique QR code for her shipment called a digital twin. The shipper puts the QR code onto the shipment, so when a customs agent scans her Efixii QR code, a web page opens that provides all the relevant information about Susan's shipment. All the attested events entered by Susan and her team are viewable through a QR code scan. Because this information is tamper-proof and attested to by a natural entity, the agent is happy to authorize the shipment for entry, and soon Susan's products are ready for sale. Finally, the distributor that receives Susan's shipment scans the QR code using his app, thus making the digital twin QR code as delivered, thereby preventing the cloning of such valuable QR codes by potential bad actors. From cultivation to retail, only Efixii's unique application of advanced RegTech technology guarantees consumers that Susan's products are compliant and are the right choice for them.